Good afternoon, everyone. Good afternoon. We want to thank you all for joining us for the symposium today. This symposium is sponsored by Janssen Pharmaceuticals, and we're so excited that you have joined with us. Before this presentation begins, we want to give you a few updates and things that you should know. This symposium is one of two concurrent sessions taking place at the same time. Both sessions are being recorded. These sessions recordings, presentation slides, and any supporting material will be available on demand in our virtual platform within 24 hours. All registered attendees will have access to the Healthy Churches 2030 virtual conference platform for 1 year. During this session, we are encouraging each attendee to utilize the Q&A box to submit questions to our presenter. Um, the chat feature is for your usage to post general comments and messaging to your fellow attendees. And after this session, please make sure you take a moment to complete our feedback survey. So without any further ado, I would like to welcome Angela Short from Janssen Pharmaceutical.
Thank you so very much. I appreciate that. My name is Angela, as Carrie said, and I am a community mental health liaison, and I represent Janssen Pharmaceutical Company. Before we get started, I want to thank Dr. Seal and her amazing team for allowing Janssen to be a part of this one-of-a-kind conference. I recall being here last year. It was my very first time, and I'm telling you guys, I was blown away. Met so many faith leaders, so many wonderful concepts, so many resources. It was just a wonderful opportunity to make sure that we're all on the same page. I am a faith-based person myself, okay? I recall being in an environment, growing up in church. I felt like I was at church every day, but that was a part of my life, okay? And that gave me the foundation to be the person I am today. When we were at the conference last year, we met leaders from all walks of life, ministers, pastors, youth ministers, and they shared their stories. They talked about their church members. I recall meeting a minister, he was in his late 80s, and he said he was a strict believer of only church principles, only biblical principles, which did not include medication and mental health. He had a life-changing experience. Someone he knew very dearly had a diagnosis of severe mental illness. And for the first time in his life, he incorporated mental health in his practice. He said it changed his life. So I'm grateful that we could bring something positive to the table that can make a change for all of us. Let me take you down to my memory lane, my life. The Healthy Churches Conference made me think about my childhood. I recall growing up in that little small church in Detroit, Michigan, Silver Star Missionary Baptist Church. And I'm telling you folks, I was churched out. I'm not for sure about you, but I was churched out. We went to church every Sunday, Sunday school, church service, and an evening service. And then we went to Bible study every Wednesday. Then at Bible study, we had prayer meeting. And on Saturday, we had choir rehearsal. It was a part of my life. My pastor was my uncle. My dad was the deacon chairperson. My mom was the director of the youth choir, and my godfather was the director of the youth. So my life was about church. And little did I know that foundation would bring joy to me as I got older. I have this desire to try to make a positive difference in people's lives. Why? Because Christ has made the positive difference in my life. Would you know, I actually went back to college, got my master's degree as a family counselor. It's all I know. It's in my DNA, and it's something that I love to do and love to give back. I worked in many aspects of counseling. My very first job was at a group home, working with children that were taken out of their home and put into a group home, a children's home. And I remember talking to these little innocent babies who said that no matter what has happened, they just want their mommies back. They just want the siblings. So it was a wake-up call for me that no matter what happens in life, when you have your family, it brings joy and completeness. And I took that with me to every aspect of my career. I've since then been in this field for more than 30 years, and I am still standing strong. I'm passionate. I love what I do. I remember working as a school-based counselor. And once again, I took that research with me to make sure families were engaged. I worked as a clinical director in different group homes and different community mental health centers. I worked as a substance abuse counselor. I worked as a fetal alcohol syndrome specialist. So I've had many roles and many jobs in this field, and I love what I'm doing. I feel very passionate 30 years later, and I want to keep doing that. My role today, community mental health liaison, allows me to work with patients that have a diagnosis of a severe mental disorder. These are families that love their loved ones. And not only do we work with the patients, but we also work with you, the families, the parents, the community, the churches. This is a village, and we can all do this together. We also work with the treatment team, which can be the nurse, the social worker, the peer support specialist, the caseworker. It's a whole treatment network. And it's all to make sure that the patients can live a life full of joy, full of contentment, and to be the person they're meant to be. We do this by utilizing the Choices and Recovery curriculum, which is a curriculum that has presentations like today, Partners in Care, making the most of your caregiver relationship. We have workbooks, we have newsletters, we have recovery logs, various visual aids that allow you to learn in different ways. We do this in a platform encouraging patients to share your truth. Talk about your journey. What have you been through? What have you learned? What lessons have you gained? What are the challenges and what are the success? We want our patients to feel empowered, feel confident and comfortable as you talk about your recovery journey. Choices and Recovery is non-branded. We don't talk about different medication name brands. We talk about options because we want our patients to have options so that when you are walking in this thing called life, you know there's more than one way that you can meet your needs. So in a nutshell, that is Choices and Recovery. We're very grateful that you can be a part of this amazing presentation. And I want to take the moment to introduce my amazing, beautiful, kind, smart coworker, Lynetta Hale. She is from California. I'm here in Indianapolis, and she's going to tell you a little bit about her and how she's going to co-facilitate with me. Take it away, Lynetta.
Thank you, Angela, and good afternoon, everyone. Actually, it's morning here in California, but good afternoon to you all, and welcome to our presentation. I'm so thrilled and honored to be part of your symposium this year. It looks wonderful. And I want to thank Angela for asking me to help her out in this. My role, and well, first of all, let me tell you about myself. My name is Lynetta Hale. I am also a community mental health liaison with Janssen Pharmaceuticals. I have been working in the field for a little over 30 years as well. I'm a licensed psychiatric nurse and also am completing my credential as a marriage and family therapist. And I'm also a substance abuse counselor for many, many years. So I came to this role via having been a director of an outpatient program with a residential component and working in a variety of settings, including forensic settings, as well as outpatient and residential programs. My role today will be to participate a little bit in the presentation, but mostly that will be Angela. We'll do a little role play at some point, and also to answer any questions you may have, or to give some of those questions over to Angela that may seem more appropriate for her to answer. So just know that there is a question and answer portion in your video, and you can feel free to ask any question that you may have, or you can do it via chat, either way, but I will ensure as best I can that all of your questions are answered, okay? So thank you so much for being here. Go ahead, Angela.
We're in good care with you, Lynetta. Thank you so much.
Thank you.
Curry, can you please advance the slide for us? Do you see anything, Lynetta?
Yes,
Okay, so we're going to talk about why are we here. This presentation is for education purposes only, and we're here to make sure that you as families and partners in care understand that you play a huge role in your loved one's life. We want you to know that we are educators, We're not doctors, we're not pharmaceutical reps, we are educators, and we're to provide information for you, hopefully that can empower you to live your life the best and to know that your loved ones need you and they love you. We are to focus on options. We don't talk about name brands. We don't talk about personal medical advice that we can give you. We're here for educational reasons. And we want you to get the most out of this presentation. And as Lynetta said, ask questions, send us your chat, send us things that you may want to be able to implement to help us grow. And we're going to do this all together because we're all in this together. Thank you.
Amen.
Let me see. Today's program will discuss the roles of a caregiver relationship in a mental health recovery. And that's what I'm talking about. We're going to have a discussion. Let's talk, let's be real, let's be transparent. Let's understand that we're all in this together. And that's how we learn, by talking, having a discussion, getting the meaningful message behind us so we can all grow together. We're going to explore ways that we can support your loved ones, that you can support each other, and that we can support our community. We want you to be empowered and provide various strategies, good communication skills, talk to each other. Sometimes we think that they know what we want to say, but we have to say it. Let's be unafraid because your family is everything. And we want to be a part of the support system to give you the tools you need to feel confident with your family members. Next slide, please. Let's talk about recovery. Recovery is an ongoing process. When a person has a diagnosis of a severe mental illness, it is something that's going to be a part of your life forever. And that's not a bad thing. I say that's the beginning of your life, because once a person understands that there's something that may be different and you get a name for it, boom, you can move forward. You know there are resources out there that can help you. But I want you to know this as well. Just because a person have a diagnosis of a severe mental illness does not mean that is everything. That's one entity of your life. You're so much more than that. First of all, you have a name, you have a personality, you have goals you want to reach, you have family, you have friends. You're more than your diagnosis. So please make sure you understand that and you encourage your family members as well. Each person recovery is unique and it's different. Why? Because you are unique. You are an individual person with individual goals, and we want you to also put that at the beginning of your life. Recovery is more than just your symptoms. It's about making sure you are connected to a treatment team. You understand that there are people out there that specialize in this field who want to help you. But to get help, you got to ask for help. Use that voice, communicate. We want you to be empowered. You need to have a seat at the table because you are the person that can make this happen. So to do that, we want you to ask questions, get involved with your treatment team, find out what their roles are and how they can help you. Each person needs to have a meaningful, personalized treatment plan. And that is goals that you are working on yourself so you can feel better in life as you move forward. Those are some basic definitions to defining the recovery role. And as I said, recovery is different for everyone. So this is just like a little teaser of how it may apply to some of our families. Next slide, please. Together, we can do great things. I like that, great things. We want you to be involved with your loved ones and talk about ways that you are comfortable, ways that you can help each other. Try to be clear when you ask questions, when you ask about the goals, and try to be supportive. Be open-minded, be honest, and communicate often. And more importantly, please celebrate your achievement. Celebrate the success. Celebrate the fact that you are here today, trying to find more information that you can empower yourself to be a more supportive system for your loved ones. Next slide, please.
Uh-oh, it looks like we may have lost our slides.
Okay, I thought so. I thought it was just me. The next slide. There you go. It's the icon. It's the one above
Number
that.
5, slide number 5, Carrie. There
You go. And this is important, Carrie. Let me tell you why, okay? Look at this icon. Making the most of caregivers' relations. That's right. Do it with me, Lynetta. Look at that heart. In the midst of that heart, it is the recovery journey. This reminds me of, you remember that song, Lynetta? He's got the whole world in his hands. Absolutely. And I think about the name of this conference. It's about healthy churches. It's about the love of God. I think that God has us all in the palm of his hand, Lynetta, and he cares about us and he loves us unconditionally. When I see that icon, I think about you, caregivers, treatment team members, having the patient in the arm of your hands, knowing that you love them unconditionally, knowing that their interest is your interest. And we want to make sure we always bring this to the forefront. When things get tough, which they sometimes will, remember that you have them and they need you. So let's always keep that in the back and the forefront of our minds. Next slide. There you go. What are supportive relationships? Relationships that are supportive are rewarding and they're positive. They're the times that you can trust each other, that you can talk to each other as you go on this journey. I have to say, mental health can be a very stressful situation for folks. And I want folks to understand that it is a brain disease. No fault of anyone. It's just something that happens. So it's important to be supportive to family members when they actually find out that this is their life and let them know it's not the end, it's the beginning, especially when you have support. Next slide, please.
Well, maybe perhaps right now we could stop, Angela, and do a quick question and answer.
Do it.
We have a lovely question from Belula Oldham. Stating, during COVID-19, how can you assist someone with their mental health when they are struggling?
Great question, and very relevant and very true right now with what's going on. Lynetta and I do a lot of Zoom calls. We do a lot of workshops and presentations for treatment teams, and we provide these choices and recovery resources that are very empowering. It gives you a lot of positive strategies to try to beat the odds. We encourage you as family members, if you can't be there with them, call them on the phone. We do drive-bys, blow your horn, say, hey, I love you. If you can do Zoom, sometimes you want to see their face. You want to make sure they're okay and they want to see your face. So if you can't be with them face to face, hand and touching them, call them, Zoom, whatever virtual network you can use, make sure you're there for them. Talk to them. Lynetta, you have any suggestions that you want to add to the table?
I think it's just important to be mindful that your family member, your loved one that you're supporting is experiencing this sometimes in a traumatic way. Absolutely. In that they've got symptoms that are occurring, they're feeling a sense of hopelessness and helplessness around that, and add to that a global pandemic where normally we would encourage them to have socialization with their support system, and now we're encouraging people to make sure that they're safe. So it doesn't mean that you can't see your loved one. It just means that everybody needs to utilize safe measures to do so. I recommend FaceTime if Zoom or any other kind of computer form of platform is not available. And also, writing good old-fashioned letters is nice as well. Sometimes your loved ones may end up incarcerated, and that's what they rely upon, is making sure that they get a letter from you as frequently as possible. Absolutely. So those are some things I do.
And it's important, Lynetta, for us to find out if the loved one is safe, right? I mean, this is a very vulnerable time for a lot of folks. So I do want you as family members to ask that question. Hey, are you safe? Do you have a backup plan? Do you have a safety guide that if something is not working out for you, can I get in touch with your treatment team member? Make sure you have that conversation. Don't be afraid to ask that difficult question like, are you having suicidal thoughts? Ask that. You don't want to have any regrets because we're all suffering here. And if you have a relationship with someone in your church, make sure they're in the know. Maybe they can do some visits or call them or pray for them. Prayer works for me. And so I want you to understand there are a lot of options. So make sure you are in the know and ask other family members, what are you doing to make sure your loved ones are safe and engaged? Journaling is also a good thing, to write down your thoughts and write down what are you doing through this process that you can maybe help someone else. So thank you for that question, and keep those questions coming. And if you have any comments, we want to hear those too. So let's talk about who is engaged in the part of that network support. It is Just the client? Is it just the patient? What do you think, Lynetta? Is it the patient solo, or do they have other support system in hand?
Well, typically, as we know as clinicians working with clients, yes, there's a multitude of supports. Oftentimes, unfortunately, people don't know about all of those supports. Supports such as NAMI, the National Alliance for the Mentally Ill, Mental Health America, 12-step supports, obviously church support, peer supports, and we could go on and on. Angela, I'll let you take back over on that.
Well,
There's some
I
questions
love that,
coming up.
because we need all the support, and I want you as families to know that you are their support too. As I said earlier, I worked at a group home, and the children said that no matter what has happened, they want their families engaged. I don't know if your loved ones tell you, but we do these workshops all over. And no matter how young or how old, they're always saying, I want to make sure my mom, my dad, my sibling, my community know I'm here. Know I love them. They need to hear from you. You're their number one support. So no matter how difficult it may seem sometimes, you need to be engaged. You need to play a role, and you ask them, hey, how can I be engaged? What do you want me to do? And I assure you, they will let you know. Next slide. Working together with your support system is about talking. It's that thing called communication, using that mouthpiece to articulate what you need and what you want, making sure that there's a backup plan. For example, like now, this pandemic, people are alone, they're vulnerable, they have crisis, and they're just scared. What is the backup plan? Do you have a safety plan that if my life is going differently, that I can call someone, that I know my therapist, that I know my doctor, that there's a best friend, a sponsor? Make sure that you get things in writing so that when things occur, you will have that backup plan. Do we have another question, Lynetta?
We have many. I'm answering one right now. I'll come back to you in just a moment.
Awesome. Next slide, Carrie. Here you go. These are some wonderful ways that you, as family members, as caregivers, as support team, can help your loved ones. When it comes to their appointments, they want you to be with them. It can be very intimidating at times to walk into a doctor's office with all these big words and these questions and expectations. They want to see someone who they know, like the father or the minister or the brother or the godparent or a friend. It doesn't have to be a blood related person, just someone who knows you and get you. They want you there to just hold their hand, to write down questions, to lend an ear, to maybe write down notes. As I said, sometimes these questions and these answers are pretty deep and very medical based. And sometimes clients are kind of afraid to say, I don't understand that. Where if you're there as that support system, you can be there to kind of break it down for them. So appointments are something that are very needed for you to be able to progress in your recovery. They need to make those appointments. Another thing is health, making sure they have someone with them as they try to be healthy in life, try to work out. I want to share a personal story about myself in this pandemic. I have always been a person who liked to do Zumba. Lynetta, I think I'm a Zumba queen. I probably am not, but I feel like I am. And it got to the point where I've been doing the same thing for 6 or 7 months now. And I felt like I was stuck. And I'm like, I need to do something else to motivate myself. So I had to call an expert, a personal trainer. Would happen to be Marcus Daniel Short, my son, who now specializes in healthy workout and exercise and eating. And I said, Marcus, I've been doing this here, Zumba, forever, and I feel like I'm not making any progress. Well, he said, you do the same thing, you get the same results. So Mom, you need to step it up. I'm like, well, what do you mean, Marcus? He said, you need to implement jogging in your routine. Jogging. I never thought about jogging, but I said, I'll give it a try. You're the expert. Lynetta, I've been jogging for 3 months now.
Yes, you
and
have.
I love it, okay? It's a different sort of a workout. My mind is clear. I'm looking at all the wonderful creation God has given us, the moon, the skies, the stars, the fresh air, and it's a different level of exercise for me. So here I am, an older mom that can go to my younger son to get some advice. And I say that to you because I want you as caregivers to understand that the doctors, the nurses, the therapists, they've gone to school for a reason, and they specialize in this thing called mental health. So sometimes if you see a person that may look younger than you, let's not judge them. They can bring something different to the table that maybe you've not heard of before, such as jogging, maybe eating healthy. So let's give them the benefit of the doubt. Let them give you other avenues and ways that you can help your loved ones, okay? Make sure you are eating healthy. You want to be the example for your loved ones. If they're having a hard time with the weight gain, they want to see you eating healthy. So we got to be an example even as adults. They also may want you to help them make those appointments. It gets kind of stressful and overwhelming making so many doctor's appointments. So just be there for them. Maybe drive them to their doctor's appointment. Maybe go shopping with them. Teach them how to finance their money, how to do chores. Special things that a loved one can do brings a lot of joy and a lot of hope in your loved one's life. So just keep on doing what you're doing. Those are supportive ways that you can help. Lynetta, you want
Angela,
to
we have another good question. I think that might be good for right about now.
go
Are you
for
good
it?
with that? Okay. So this is from an anonymous attendee stating, I have found that the faith community is not accepting of mental illness, especially of children with ADD or ADHD. My child was perceived as a bad child or a child with criminal illness. I was too embarrassed to ask for help, so for years I kept my feelings bottled in. Because of my feelings of failure and embarrassment, my child did not get the help they needed. The church was not helpful to me, so this session is extremely important and vital to families to make sure that their caretakers feel safe to share. I think that's a really important question.
That is amazing. I just want to say to that mom or that dad, I'm so sorry that you went through that. And you know what? I feel your pain. I think a lot of us can say that we've had difficult times in our lives. And I don't know anyone who has not been touched by mental illness, anyone. And I think sometimes when we have people who have not experienced that, they feel discombobulated or disconnected. It's kind of like I said at the beginning, I met a minister, a pastor, he was in his 80s, and he said that he didn't believe in mental health. He didn't believe in the mental health people. But when it hit home, it changed his perspective. So I want to say to you, this mom, you did nothing wrong. You are the best person for your loved one. You're the advocate for your person. So I want you to make sure that you continue to understand that all people are not like that in the church. I'm sorry. That was a bad experience for you. And it pretty much almost happened for me too. But I had a chance to really advocate nonstop for my loved ones. And sometimes I had to go to another level, another person, someone that's bigger than that. I had to go to God and ask him to give me strength and give me patience and give me the wisdom to know how to be the best person for my child, because they're innocent kids and no
Yeah.
one signs up for any mental health disorders. I just hope that you understand that your question is helping a lot of people. And
Absolutely. Absolutely. We have an answer from somebody who says, from Wanda Lawrence to everyone, we had an inclusive program at our church. We tried to involve all our children and adults in our programs.
good.
And I think one of the key messages as well from the previous person was that oftentimes mental illness is criminalized and
Mhm.
treated as though it is a characterological disorder, and it's not. It's a brain disease. And so I
Right.
think your question is doubly important in that way, and particularly in this time of social unrest in our country, in which oftentimes people of color are targeted, particularly who have mental illness. So I think these are timely, important questions, and we thank you for them.
And you know what, Lynetta, it's really hard on our Black boys too. They get the root of all that. I want churches to listen to this. And I want us to break the cycle. We're all in this together. We're the village. And that's why I'm so happy and proud to be a part of this conference, Healthy Churches. It is yet an opportunity to educate all of us, to bring us all together on the same page and understand that we need each other. If you have a child, an adult that's dealing with something different, we got to be open-minded. We got to be less judgmental. We got to be like Christ. Remember, he's got us upon his hand and he gives us unconditional love. And we've got to be the example, stand strong and unapologetic to be there for each other. So thank you all for your questions and keep it coming. Next slide, please. How can supporters help you? This is a good one. First of all, you're doing the right thing by being here today, just trying to find avenues and resources that you can do and implement in your life. We want you to learn about mental illness. We want you to ask questions. What is it? As Lynetta said, it's a brain disease. It's no fault of anyone. It happens to some folks, just like cancer happens, just like being a diabetic. It is a disease that you have to work on every day of your life. And I feel that the more education we have, the more knowledge we become. I want you to encourage your loved ones to also find out what is their mental health status. Because when they become empowered, when they know what they're dealing with, they can educate others. And we can do this together. Sometimes supporters want to tell your loved ones, hey, did you take your medicine? Especially if they feel they're a little off balance. In my profession, I've been told that they really don't like that. They want you to be engaged in more ways than just telling about the medication. Do something like, let's do a book club together. Let's talk about current events. Let's talk about who am I dating? Let's talk about how do I talk to folks? How do I get engaged with other organizations? Let's do some hobbies together. So focus on being there for them through the good times when they're on their A game. And then when the medication seems like that's an issue, it does seem so harsh on them. So make sure you engage in all ways. If you notice that they're slipping and you see some relapse, find out prior to that, how do they want you to talk to them? We talked about the making a plan. That's the plan, to ask them, okay, now when I see that you seem like you're sleeping a lot, you're kind of depressed, what would you like me to do? What's my role? And they can tell you, because I want this to be a good, healthy relationship. And it starts with healthy communication. Make sure you support them through the setbacks. We all fall short at one point in life, but we get back up. And when you have support systems around you that are loving you, that's speaking truth and telling you, I know you can do it, and then you feel good about yourself. Try to explore treatment options that's helping your loved one. Ask questions. Hey, you go to the group every week. What are you doing? Be engaged. Be informed. Let them know you care about them because they're your life and you're their life. If you're happy, they're happy, and we can all be happy together. We're that village. Lynetta, did you want to add anything to how supporters can help?
No, I have a comment, not necessarily a question, but a comment that I think is important.
Yes.
This is from Alfie. It looks like to all panelists, Black girls are also at a very high risk of being marginalized, abused, and pushed out due to mental illness. Very true. Push Out is a book that takes a look at the criminalization of Black girls in the educational institutions of our country. I love that, and I thank you for sharing that. It's a book I'm definitely going to look up. Thank you.
Thank you. And this is what this is about. When you guys have this knowledge, you share that with us because we want to all learn together. I don't think there's anyone who has all the answers. We're all learning together. So thank you for providing that book. And thank you. You're right. I think this is an issue for all people, right? I say Black boys because I have two Black boys, but I'm also a Black woman. And I have sisters and nieces, and we're just in this together. So let's learn together and let's grow together. Thank you. Keep it coming. Keep those questions. Next slide, please. Treatment support options. I want you to know that options and treatment is more than one thing. It's not just medication, right? It is about therapy. Being able to talk to someone in this field who specializes in counseling, who has gone to school, got the skills, the requirements, the education, and the background to maybe bring some resources to you. Having that connection, trusting that person, being able to be open and honest and transparent about what you're going through, that's a good counseling session. And it takes time. Also, if you enjoy doing something such as volunteer, do that. Just because a person has a mental health diagnosis does not mean you can't work. You have a lot of life to give. You got a lot to bring to the table, and I want you to really do that. Research says that when a person is working or volunteering, they feel like they're giving something back, something that other people can benefit from that. You make sure you do that. Being in a supportive housing environment is also very effective. Being around people that love you and that you love, and people that can give you sometimes some of that tough love. letting you know when, hey, sister, you need to slow it down because you're not going to treatment and we see some differences. That is okay too. And the peer component, having people that have walked in your shoes, that have similar situations, talking to them brings life to you. It lets you know that you are not alone and you are not alone. There are millions of people living with severe mental illnesses. And we want you to know that we are walking right with you. We're walking side by you. We're making sure you have the resources and we're doing our best to support you. Support groups such as NAMI, such as family support groups, NA, AA, church groups, whatever support groups you deem is good for you, go for it. Take care of your mind, take care of your body, and you take care of you. Next slide. Lynetta, do you have any more questions that anyone
No,
follow?
there's a number of questions, so let me find one
Go for
that's.
it.
I really like this one because I think it's really important for folks to know when is the best time and the best way to help your loved one who may be struggling with coming to terms with their illness. This question is from also from Balula. What do you do when your family or friend asks for money when you know they need outside help? And I will take a crack at that first because I've had much experience over the course of time working with families who perhaps have a loved one who is not willing to acknowledge that they have an illness, or maybe has been hospitalized in a crisis situation, but then feels like, I'm feeling better. I don't need to take my medication anymore. And their life eventually, of course, goes downhill because they relapse and decompensate. And so the point is to know when's the right time. The right time to help somebody is when they're actively seeking treatment, when they're actively willing to do all of the steps they need to do and the tasks that they need to complete in order to get back into recovery and be healthy and stable. That's when you help them. When they've fallen and end up in jail or end up in a hospital setting, that's not the time to help them. It's when they're ready to get help again and they're willing to follow through on it. So go ahead, Angela, if you want to take a shot at that
Love
as well.
that. And I want you to also focus on the fact that when we do fall, you don't want to hold that over their head, right? You want to be that positive support system to say, you know what, you're asking for help and I'm here for you. That is to me resonates and make families feel that, okay, I'm not being judged. So I personally think that anytime they have an open mind and an open heart, and that is let us say that they are willing to hear, when a person is deep in their addiction or deep in their symptoms, they really aren't able to comprehend what you're asking them because their mind is somewhere else, and that is okay. There will be a time when maybe they're more, they're taking medication, they're more stable, and they can really take in the information. So we want you to be patient. Be patient and just surround them with the love. And sometimes that may need some tough love. If someone's asking for money and you know the money is not going toward a good place, then you want to say no. I mean, it's tough love. And, as parents, as loved ones, we have to do that at times. But when they get older, they will respect that. I think about my childhood being just so frustrated with going to church. I'm like, oh my goodness, not another service. But look at me now, Lynetta. It is the foundation of who I am. It gives me hope. It gives me life and it motivates me because the principles I learned as a child are the principles I'm using every single day of my life. I wake up, Lynetta, happy to know that we can make a positive impact and a positive difference in the client's life that we serve today. And I look at it as service. We are servicing them because they allow us to give them a little bit of hope, a little bit of joy and resources. And that's what we're here for. So best wishes for those family members that are struggling, and just be patient and know that when the symptoms are reduced, when they are alert, that's the best time to talk to them. Did we answer all those questions, Lynetta?
There are several questions. Too many to answer all at one time. I know we need to move forward. So we'll get to
forward,
that.
okay. And I know you condensed some of those questions, so that's awesome. So let's talk about short-acting medication. Medication is really a part of a person's life that has a diagnosis of schizophrenia. 90% of clients that have a diagnosis of schizophrenia are taking medication, those that take medication. Medication comes in many forms, many ways since the beginning of time. You got the pills, you got the oral, you got the dissolvables, and you also have something called short-acting injectables. Now, I don't want you to get confused with this opposed to the long-acting. So the short-acting injectable is when Normally a patient has been out of sort, they're not really engaged in treatment, they're kind of just out there, and families are worried sick. They feel that you may be at risk to yourself or others. They sometimes have to get the treatment team involved, and the client is sometimes brought into a hospital, and the medical profession has to give them that short-acting injectable. It kind of calms them down, reduces the symptoms. Nobody wants to get that injection, and nobody wants to give it. So just know that when that happens, we know that it does traumatize patients. It makes them think that I never ever want to see injection. But there is good news. There is something called long-acting injectables, and it's an option. So I'm gonna ask Lynetta if you can give us more insight on that. Next slide, please.
Sure. And again, remembering that those short acting injections, sometimes we call them cocktails, are given in a very different setting, typically in a crisis situation where somebody is dangerous to themselves or others. And so it's not a voluntary injection the way a long acting injection is. And long acting injection can be anywhere from 2 weeks, 1 month, or even less frequently. Or more frequently. The slow acting, long acting injectable is given via injection in the deltoid or in the gluteal. And it is slowly released over time, over the course of that entire time, so that you get a daily dose of that medication every single day without having to take a pill. And it's given by a healthcare professional, a nurse such as myself, or another healthcare professional, and it stays in the body longer and covers many of those psychotic symptoms that folks with schizophrenia or schizoaffective disorder may have, so that if there's any kind of a change in their environment or in their life, the issues can be addressed before they have a relapse. And so it's very beneficial. These medications have been extremely popular for younger people coming into the mental health treatment setting, because they don't have to go through 5, 6, 7 cycles of all the wrong medications till they finally get the right medication, end up in the hospital, get washed out on those meds, and have to start all over again. In which case there's been cognitive damage and deficits as a result of gray matter lost during that process. So these are really helpful. And I saw one of the questions addressing how do you help somebody who's new to maybe even looking at whether or not they have a mental health condition, and maybe you're in denial about it or don't even know that it exists. And that's very frequent with younger people. They don't understand what's happening with them. They may be having symptoms that are unfamiliar to them. And so it's really important just to remember that having the discussion, frank discussions about what you're seeing about their behavior is really important. And the relationship you have as a caregiver will help have those conversations. And then knowing that long-acting injectables could save them from years of these types of experiences.
Absolutely. I saw a comment said that they want us to increase our volume. So let's talk a little louder about
Okay,
that.
sure.
And I also wanted to compliment what you said about the long-acting injectables. I want you guys to understand that we're giving options. It is so important for patients to know that there is more than one way to get their needs done, their needs met, the recovery process. A long-acting injectable has been out for many, many years. And Lynette and I both do workshops and presentations all over. And I am really still a bit surprised when I ask the question, how many of you have heard of a long-acting injectable? And I say about half of the patients have never heard of it. So I'm saying this, Lynetta, we've got to do a better job with getting the information out. We got to make sure patients know that there are options. Patients say they get sick of taking a pill every day. They don't like the way it tastes. It gets stuck in their throat. One patient said that when I take a pill, it makes me think something is wrong with me. It's a reminder. Well, I say this to you, patient, there's nothing wrong with you. I think most of the people in the world, we take medication for something. So if the medicine is working for you, please keep taking it. What we don't want is it to be so dysfunctional that you stop taking medicine and you relapse. We don't want that. So that's why it's important to communicate. Talk to your nurse, your doctor, your prescriber. Let them know how you are feeling. And then you may want to ask them about long-acting injectable. When they realize that you get that knowledge, they're like, okay, this is great. So take this information and share the love with others. Next slide, please. Medication consideration. Now, once again, as we said, medication is not everything. It is one of many aspects of a person living with severe mental illnesses. When you meet with your doctor for the very first time, it is so important to provide true medical history. This is not a trick question. This is not a time that you think that the doctors are judging you. Their role is to ask as many questions about your history, about your upbringing, about medication experiences, about family members that may have been on medicine, because they want to give you the correct diagnosis. To do that, they need that information. And once they get that information and you get the diagnosis, then the progress can start. Then the medication discussion can be had. The side effects, the benefits, the risk. Just know, giving information is information they need for you to move forward. Next slide. Building a relationship together, it's all about partnerships and being on that journey. We want you as partners in care, as caregivers, to share the recovery goals. Share the resources that you know. Someone called and talked about the book. Make sure you share that love. We all need that. Share the recovery process. Make sure you ask your loved ones, tell me about your recovery goals. What are you doing? Tell me about your treatment plan. What does that entail? Let's talk about ways that we can work together, that we can support each other. Because with that family bond, that's what it's going to take for you to feel encouraged, empowered, informed, and equipped to be the best that you could be. Lynetta, did you want to add anything to that?
No, but I have a couple of questions that have come up.
Absolutely.
This question is from Todney Roll. Do you believe in prescribed meds for mental health is a better option? And so I'll let you go with that first, and then I'll answer as well.
I believe that the professionals, the doctors, the psychiatrists, the prescribers, that's their role. They've gone to school to perfect that field. And I think that it's important for clients and patients and families to meet with those professionals to get those resources, to get the information that they can provide them. As we said that, Lynetta, we are educators. So I want to stay in my lane, right, Lynetta? I want you to know my role, my expertise.
Absolutely.
Is to talk to you, to encourage you, to listen to you, and to work with you. But I want you to go to the professionals, the doctors, and ask them about the medication options. They can give you the real detailed information of what medication is supposed to do and how it's supposed to work.
Yes, I absolutely agree with you. Any mental health professional who simply says medication is the answer is not ethical. There needs to be a full assessment of symptoms to determine whether there's even a diagnosis, and then a referral to a psychiatrist or prescriber to have that conversation about whether medications are appropriate.
Absolutely. It's kind of like the one screen we just had and talked about share your medical history. It's a full circle. It's not just medicine, it's many, many other aspects. So you make sure you reap the benefits of all those resources. Next slide, please. Okay, communication. We've been talking about this, right, Lynetta? It's about listening. It's about learning. It's about having a two-way respectful conversation. When a client or a patient, your loved one is talking, let's try to listen to them. Let's try to really hear what they're saying and support them. Let's be open-minded. Let's be clear and non-judgmental. Let's try to understand what their expectations are, and you articulate what your expectations are. Share your thoughts, share your values, share your goals, and be very careful when you listen. Sometimes when people are speaking, we are thinking about the next question to ask or the response. Really allow your loved ones to get it out, because it takes time for them to process all of this information thrown at them. So just be patient and just let them really learn and really expand those communication skills. Next slide, please. All righty, now this is the part that Lynetta and I would like to present to you. In our presentations, we have workbooks, and we always try to get the parents and the client together. This is an opportunity that Lynetta's going to be the patient and I'm the sister, and she's going to share with me some of her thoughts that she's having on this recovery plan. I'm going to listen and give her my thoughts. So, Lynetta, what I would like treatment to address most is your turn.
Well, I don't really know what I wanted to address. I just know I want to feel better. I don't like the way I feel anymore. I want to feel like I did before I started hearing voices. And before I started feeling like everyone was watching me all the time, but you guys sometimes do. I feel like you do. And, it'd be nice if I could smoke pot again. I know, no, I'm not supposed to. I can't live in the house if I do, but, I thought that was helping me. But, even my doctor's saying it doesn't really help me because, it just makes my voices worse. And I guess that's kind of true. Sometimes it does. But I just want to feel happier again. I want to have some fun. I just want to be with my friends and not have them not look at me all weird and have you guys watching me all the time. So I guess I just want to feel better. I don't know, maybe get on the right meds, something. I just want to feel better.
Well, as your sister, Lynette, I want you to know that I'm listening to you. And I am in deep thought as you say that you want to feel better and that you want to feel that we are listening. I realize now I apparently was not listening. If you feel that way, then I'm doing something to make you feel that way. And I want to apologize. And I want to be a better person. I want you to know that I love you unconditionally. And I know that you're going through so much and you've made so much progress. And I want you to know that I see you. I see the struggles. I also see the great steps you've made. And I want to encourage you to continue making those steps. And know I am there. You let me know what role you want me to play. And I want to be there for you.
Thank you. I don't
Yeah.
want you guys to be embarrassed of me. I want to do better. I'll try.
I would never be embarrassed. You are part of me. You're my sister. And I could never be embarrassed. I'm happy that you are a part of me. And I love you.
I love you too.
So I want you guys to see just a nibble because I know we run out of time, but this is how transparent that this can be. For the first time, you have patients and you have caregivers talking about things that they really want to ask but didn't have the platform. Choices in Recovery gives them the platform to do that. So just know we have workbooks, we have newsletter, we have recovery logs and presentations, all for your benefit. www.choicesandrecovery.com is our website. And we have some amazing resources for you to utilize. Make sure that when you meet with the treatment team, according to HIPAA, there's a consent form that you must sign to make sure you can be engaged and talk to the treatment team. So make sure you talk to your loved ones about that. Next slide. Together, you can do great things. You can be the one that can support your loved ones. And you do that by having that comfortable, transparent conversation. Be clear with what you want and what they want. Allow them to communicate. Allow them to be vulnerable. Allow them to cry and make mistakes and let them know that you love them. Celebrate the success. What time we got? Okay, so I want to share a quick story. Me as a clinician, worked in this field for many years, got a phone call maybe 10 years in my field that someone I love dearly was suffering with some major symptoms. And I was, like most of us, in denial. Went home, yes, the truth was the truth. My loved one needed help. Went into the hospital, we all prayed like we do, met with the doctor, and the doctor said we need to consider medication. Now, being that strong Christian background, that was a question mark, but the doctor was so insightful. He gave us an education. He let us know that there's a brain disorder, that this medication can help more level the brain, and that he can have a more productive life. So after making sure we talked, we prayed, we talked to the doctor, we trusted the doctor, and we gave that loved one the benefit of the doubt. He's doing better. It's because we had to understand that prayer, medicine, and research goes together. One does not overtake the other. So I want you to know that when you have someone that's living with a severe mental illness, please allow them to talk to the ministers. Understand that's important for this here community. But also ministers, please talk to the doctors. That's important for the client. Make sure we're all together. We're in this world together and we love each other and we want the best for each one of us. On behalf of Lynette and myself and the community mental health liaison representing Janssen, we thank you so much for spending your day with us, for learning with us, to sharing your ideas. Keep it up. The end.
Thank you, everyone. And if we didn't get to your question online live, I so apologize. I'll try to, if they're still up, answer them as best we can via text. So many great questions. We really appreciate your participation and we're honored to have been here. Thank you so much.
Don't forget that book.
Symposium.
That book, Push Out. Monique Harris, thank you. Monique Morris is her name. Push
Yeah.
out. Thank you, guys. We
All
hope
right.
to see you in the future.
Bye-bye.
Bye.